So welcome back to the Australasian Symposium on Programmatic Approaches to Assessment. We're in the session 3, so we're on the home stretch after lunch. Hopefully you had something nice to eat. So today we're going to be covering quite a range of things related to faculty and school level case studies. Thomas is our timekeeper and MC for the afternoon. So Thomas, would you like to take it off?
Yes, thank you, Matthew, and welcome everybody to the afternoon session for our symposium on programmatic assessment. And yeah, we have quite a good lineup of speakers talking about faculty and school level case studies with Kellie, Charles, and Stuart, Uni of Sydney, Melissa, Oxley from Deakin University, Anthea, Cochrane from University of Melbourne. I hope I'm saying the names right. And so Higdon and Jamie and Mark and John. I mean, there are some, we have a break in between, and then later Haley and Bugeya and Hora to finish off this session. So, you know, they're sort of allocated. You have 20 minutes and there's 2 speakers, so about 7.5 minutes each. And then you know, we have question time, which is always important. I mean, from the morning session, there's so many questions to address, and you also have, remind you, the chat box to put questions in there. So to get started, Kellie, you ready to hand over to you straight away?
I'm actually going to hand to Stuart first, who will go first.
Stuart?
I'll go second.
Yeah, you go second. Yeah, okay, yep. Sure. Thank you.
In that case, just checking that the actual slides are in the correct order for that.
No, sorry, Kellie is first because that's the way they're burnt into the system. Sorry.
Oh, okay. Well,
over to you, Kellie.
All right, okay, I'll go first then.
We can make it work.
So I'm going to talk about prescribing competencies within the medical program. I'm a pharmacologist, which is a scientist, but I work on the clinical end of the spectrum. So I've also been very lucky to have helped with Stuart and Priya in designing the programmatic assessment for our medical program that was delivered in 2020. And I'm going to talk about one of the components, a vertical theme or longitudinal theme of therapeutics, which is in my, I guess, academic wheelhouse. And, that's right, I've got to click through. So I come from a family of chefs, and so foodies are a big thing for me. And I see programmatic assessment a little bit like an amazing meal, that it's complex and complicated, and that requires multiple elements to have this cohesive dialogue to provide a comprehensive vision of what the food is, or, you know, equivalently in student terms, that we have this comprehensive vision of what the student is capable of. And so as assessors, having multiple bites of that particular portfolio where we see multiple elements being, you know, tasted as such, can help us make better informed decisions. And this is some amazing food from Mido in Peru, which is, you know, these razor clams. And you can see there are multiple times that we see the same parts of the dish in multiple mouthfuls. And I think that's really lovely kind of analogy for what we're doing with programmatic assessment. So I've kind of put my talk together as a bit like a recipe. So step 1 is that, you know, thinking about, you need more time to think and plan when you're doing PA. It takes way more time than you think. It needs lots of people to help support and plan and implement your sort of vision of what this is happening. And we had a really large team in the medical program. There was probably a good dozen or more people, but then beyond that, each of us had our own sort of internal teams of another 10 to 15 people. We know that this is a long-term plan. We were very accepting that it was an iterative process and that we wouldn't get it perfect in year 1. So we knew that we were going to have to keep changing things up to try and get it closer and closer to being that best dish. So for us, we actually took 2 years to almost get this right in that first iteration. We moved both to competency-based framework of sort of leading our programmatic assessment. Therapeutics became a new theme out of 4 that were already existing, and we got 4 new ones. And that meant that we had to really think about how are we teaching and assessing in every single block across the whole 4 years of this postgraduate program. My second piece of advice is to start at the end first, and think about what level of preparation do you need for your students? Do you need a Gordon Ramsay style multiple expert? Do you need a proficient expert like a head chef? Or do you have a competent person, like a really qualified, well-rounded apprentice? And hopefully you don't have a Swedish Chef Muppet, a novice at the end of your programs. And so we used a novice to mastery framework for the Dreyfus and Dreyfus model to really guide that distinguishing features across the multiple years and how we were going to choose the types of learning activities and also assessments that we would go from, so that we could build people up from novice stages where they knew nothing to being areas where they could transfer theoretical knowledge to practice. We also looked at what our standards were for prescribing. So the Australian Medical Council says that all graduates of a graduate program of medicine should be able to prescribe safely and effectively within guidelines at a simulated and theoretical level, not at a practical level. So we didn't have to get to the stage where we were assessing them practically, although I would love to be able to do that, and I'll show you that at the end. We also checked where the students thought they were before we started, and we were lucky that the AMC had done some surveys with graduates across Australia and New Zealand. And you can see from these three graphs from 2017, 18 and 19 that IV fluid prescribing and prescribing of medications are the least prepared of all of their clinical skills. And so we knew we had a lot to work from. We also they had sort of assessed or surveyed their students to find out what worked. And we were able to kind of build on this knowledge from students. They wanted more resources, they wanted more practice, they wanted clinical exposure, they wanted interprofessional learning, and we could actually bring that together. We used a realist evaluation, so using a very theoretical approach to guiding our decision making also helped at defining how we best prepared our students for practice. And so it was really important that we noticed that we were lacking this transfer between theory and practice and giving students lots more opportunity for deliberate practice. So being really explicit about our design principles was key. As our final step, we really wanted to design a spiral, constructively aligned, comprehensive curriculum that started really, really early and incorporated a lot of assessment for learning and actively integrated thoughtfully our clinical skills into workplace-based learning, but also that these assessments were equitable and best prepared them for their competency exam at the end of their final year. So what do we do? We have a combination of knowledge-based assessments as well as clinical skills assessments. So in the first year, it's very theoretical, knowing all their drugs, starting some history taking with medications in first year. In second year, we started our clinical pharmacology and integration into their workplace learning. So a whole 2 years earlier than we'd previously done. And you can see these yellow little blobs down the bottom, little bubbles. These indicate formative assessments. So we weren't looking for accuracy. We weren't looking for perfection. We wanted students to submit tasks that were representing their process of learning from a very early stage alongside their knowledge-based assessments exams, which were secure exams. In our third year and fourth year, we move into fully integrated clinical medicine. And it's here where our students started to do their own self-directed formative learning for knowledge that fed into their knowledge exams. They included workplace integrated learnings as formative assessments in their portfolios. And then in our final year, we have a final assessment, the prescribing skills assessment, which is a national based exam for prescribing competency, so that all of the institutions can sit the same exam and know that all their students have the same theoretical knowledge across the 8 prescribing domains. I've got this green, really, large blob on the end, which is I would really love to be able to assess our clinical skills in a real world workplace integrated learning. And I think that's kind of the next step, because I think that's the real missing that the students find as they move into internship, is that they don't get on the system and they don't know how to use the system when they're first day in their new jobs. And New Zealand does this really well. They've got a really lovely assessment model that they use for their final year students under the supervision of their interns. So they build this really lovely community mentorship relationship with the senior student above them. And I'd love to be able to bring that into our programs for next year. We're going to try and pilot it, and then it might be something we roll out across Australia for a competency-based assessment of clinical skills observation. And that's really where I wanted to end. And these were my recipes for success. And I'm happy to hand over to Stuart. So I think I can go through these last slides. If you have any questions, I'm by email, and I can zip through these other ones because these were just extra slides. And I'll get to Stuart's one in a second.
Thanks, Kellie. Stuart, you all right?
I'm ready to go, yes.
You ready to
Let
go?
me
We're
find
just
your
waiting
slide.
for the slides. Okay.
There you are.
Here we go.
Thank you. And, so good afternoon, everyone. Great to see you. What Kellie's presented there, I think, is a clear example of a part of a program which is very well aligned to what PA was meant to achieve, authentic and real world, especially in healthcare world assessments and learning, which students would appreciate. So what I'm going to go into is the things that would come out of those actual program delivery and designs, which are reflected in different parts of the program, which aren't just therapeutics, for example, ethics, law and professionalism, or clinical skills, or biomedical science. The actual response is very, very similar. What I'm going to show you is, or go through with you, is a lot of, I guess, reflections, current discussions, and future thoughts on where we have to go for the future to make this evolve in the right manner. And a lot of these are, verbatim or paraphrase quotes from people about what their experience actually is. So I'm hoping this session here will be very practical for you that are thinking of developing or designing this sort of assessment, and the things that we've learned from not mistakes that we made, but things we didn't think about at the time. We've had to reevaluate and evolve since. So it starts off with this consensus statement where there was 12 points which people put down, this group of international experts. And I think a lot of people looked at this model and thought, well, if we put these 12 points down here and we include that in our design, delivery and development, we will instigate PA in a fantastically smooth and wonderful manner. But it wasn't really that straightforward, because the tick box competency, which we assess for other assessments, doesn't always work. The nuance is what's really important here. So I think the actual architecture of PA for your design, development, delivery is maintaining these three principles of longitudinal assessments, proportionality in decisions, and triangulation of data. And what I'm going to come through here is going to really relate to these three perspectives. So I'm going to look at 5 areas of focus which we've experienced: the students and your language and their interpretation and their perception, the institution you work in around their policy and procedure, how to be opportunistic and flex your current curriculum, what triangulation really means and the problems and the evolving thoughts on that, and as Kellie mentioned, the significant workload to your team and what that actually entails. So here's some of the actual language that's important, because if you are designing, developing and delivering this system, every little word can get challenged, and every single word you put down there can have implications or inferences which can confuse, can become ambiguous, and can lead to problems. So we talked about PA being no longer having high stakes assessments. It's multiple low stakes. To many students, the idea of high or low stakes didn't really make any difference. You've gone from having one end of year barrier high stakes assessments to multiple high stakes assessments. Now I'm having these high stakes every single week or every single fortnight, and it's exhausting. Everything counts now. My stress levels are higher than ever. Practically, in a PA course, we discussed the need for remediation and further assessments to give them a chance to actually get to where they need to be. But as you know, a lot of healthcare curriculums, especially medical curriculums, are so jam-packed with activities and learning. If you're going back to actually concentrate on things they haven't quite grasped and they've moved on to new areas, it's really hard to fit them all in. It's never ending for students that are struggling, and they can fall behind very, very quickly. And for many of them, and this is often constrained by university structure, we talk about longitudinal improvements by the time you graduate. It's still about, I need to get through this year. I need to get into the next year of the course. What do I need to do? The mindset of pursuing my long-term benefits of experiential and lifelong learning are not really in their mindsets at this moment in time. When we talk about assessments that are transparent and credible, people still see it as being subjective and opaque, and therefore that's unfair. We talk in a similar vein. It's got nuance and context. To many students, and actually many staff members too, that's inconsistent, and therefore by definition, this assessment and this assessment program seems unfair. So language and interpretation, it's a cultural change for all staff and students. And when we talk about staff, we mean all staff, including clinical, academic, and professional staff at the school, the faculty, and the university level. In the University of Sydney, we're trying to move towards a program level design, but we've gone past that to programmatic design, and the rest of the university isn't quite with us yet. You need to constantly change, and updates are expected and required. That's pretty hard in a place where they want things in line, semesters in advance. And it has to evolve locally to your student cohorts and to your assessment design and your programs, which requires a lot of clarifying, explaining, and actually thinking ahead, forecasting in all areas. We are consistent, we think we're transparent, but as much as possible, some things have to evolve and be allowed to evolve and to be actually incorporated. It's impossible to be completely transparent about everything because things arrive that you weren't expecting. We've all been constrained by this, the university policy and procedure, and I hear lots of concerns from many colleagues about this special consideration system, that when you go from having 4 or 5 big assessments a year to 34, 40 assessments constantly, and everything is amenable to consideration for multiple replacements, that is not sustainable. It's true, it is hard to do that, and you're constrained by your policy saying you have to do this once or twice. You have to find ways to work around those, to interpret them for how your program will actually benefit. You can imagine what appeals are like in a university system, which has got dichotomy of actual pass-fails. So when you get to a subjective, nuanced, contextualized decision, you can imagine the amount of appeals that happen at every single level, school, faculty, or university. We've been through this significantly. And my advice to you is you have to be prepared to have it appealed and to go down the appeal pathway to really produce and solidify the robustness of your procedures locally. Because if you haven't got that, you're going to get really stuck into lots of ambiguity and uncertainty and the ability to have things overturned and having to make really rapid changes. University policies, in my belief, are actually interpretable if it's reasonable for the best interests of the students, and that's not always them getting what they request. It can also mean meeting standards for them to progress to the year safely with the skills that they need. So real institutional change of policy and procedure, it's not really going to happen at the big level, but interpretation and local negotiation can happen. Now, we had all these things that we developed recently, and then AI comes along, so we're going to have to reevaluate everything we've done with all the current policies and procedures in regards to how we design curricula and how we test it. Secure assessments, non-secure assessments, all that language is really much in our foreminds now. HERDSA has actually been quite beneficial for us. They've brought the requirement for all you need to study to have early assessments and feedback. With PA, we're doing that. So we look like we're HERDSA compliant from the very beginning. That strengthens our positions both in the schools and the faculties, aligns us to all different institutions that maybe aren't actually at the university level. We're aligned to high schools, postgraduate colleges. The educational world is bigger than the university and the faculties. Therefore, if we can align to a big educational curriculum, community, that's actually good for us. But we are in the minority in the university of using these frameworks. And therefore, what we need to do is use our innovation creativity to drive the future design and drive that future. Opportunistic, you've got to flex on your current curriculum, which I know will be packed in many ways, shapes, or form. How can you utilize things differently? This is our curriculum. I'm not going to go through it in great detail because you've all got similar curriculums. All I would say is bottom left and bottom right hand corners, there's 2 purple boxes. They are electives. They are student choice areas, which of course they want to go and do. But if students are struggling to demonstrate the skills that you need, then surely it's an opportunity for them to get more learning, more assessments, and more assurance of their performance, especially in later years of the course, when you're graduating your community doctors or nurses or pharmacists or physiotherapists. Be prepared to say, yes, I'm sorry you can't go on your elective over to Toronto, but you can get a chance to do some more of your year 3 demonstrations and actually enter year 4 and graduate on time as compared to having to repeat the whole of year 3. Triangulation. I know Pri will like this because we spoke about this many, many times in the past. Data points were actually spoken about in the original 2020 consensus. But ultimately, we talk about the need to remediate people and further assess them. But where do you do that? Either whatever you do, it's not sustainable. We started at the end of the year. It was too much to cram in. We started at the start of the year. It was too early. We've spread it between the middle and the end of the year. It's still hard to put in because you are trying to take people back to areas of learning they haven't yet demonstrated whilst they move on. You've got to come to some compromise to make it work. And it's not easy, especially if students are finding it hard. The data point model, it's outdated. It's got to evolve. You know, we've got 12 to 15 data points in every single year of the course, which either are single assessments or multiple assessments. And the students want to know, well, what does data point 1 plus 2 plus 3 plus 4 plus 5 equal? How do I progress? You've given us these grades, nebulous grades, expected standard, borderline or below. What do I have to get in every single data point to get through? So the future's got to be triangulation of data rather than data points. To demonstrate that, we currently have this. Imagine those 9 circles are 12 to 15 circles. They're data points directly relating to an outcome from the year. What we need is this. 30 or 40 different assessments or whatever number you use, which end up going to 10 capability frameworks and triangulating all the bits of data that you can into these areas to make it work. Now here's the big thing, the workload. Remediation and further assessment, and students have requested this, it requires feedback. That's a lot of feedback, and that is hard for individual assessments and holistic assessments. When you've got ongoing need to retest people and further assess them with ongoing attempts, how many are reasonable before you say, we can't do this anymore, and what the impact on your overall year progression is going to be? A holistic assessment in a competency committee, that's a large commitment from a large number of staff at multiple times per year, as compared to our previous model. End of year examination committees, everyone gets together. The workload, it duplicates far more times than just times 2 or 3. It is big. And your IT systems, which we think will help it, they're not a panacea, but they can help. They can organize and collate data, but it still requires human decisions. So you've got to get staff and institutional support to really make this work. But, you know, we're doing this for a reason. And when we look back, you know, large-scale summative assessments, they had assumptions, they had flaws. But honestly, if we think about it, they were just convenient at a certain time of the year when we put all our efforts into getting everyone there to do them. People ask for this for many, many years. Students who are borderline in certain areas, they wanted to take into account other aspects of their year to say, well, actually, based on everything that I see here, they can progress rather than their dichotomous pass or fail on knowledge. The outcomes of large summative assessments, they weren't trustworthy, they weren't valid, they weren't reliable, we can do a better job. What would you feel more reassured from for student progression? The previous system, or a new system that's not working too well? A new system that's not totally evolved, I put to you, it's better than the old system in many, many ways. But you're going to take a long time to get it right. If you ever get it right. Did we ever get the old system right? I don't think we ever really did. We've made patchworks on the old system. We thought, well, we can't keep it going forever. And I think we know, and I think from a medical and a healthcare perspective here, but for assessing students and the future healthcare workforce, we really believe this is the right way to assess them. But it's not easy to develop and definitely not easy to implement, as we've found out. But at the end of the day, nothing worth doing ever is. And we know that, we believe in it, therefore we stand by it, and we try and make it work as best we can. Thank you for listening.
Thanks, Stuart. We try to make the best we can with everything. Thanks for your presentation. That was great. We got 5 minutes question time for both of you, Kellie and Stuart. And we can try, if you want to raise your hand, and you can ask the question through the microphone. But to start off with, I just see at the bottom here, Kate, you have a question about, to Stuart, why there are so many 10 capability frameworks. And there were also a couple of questions about the...
Yeah, so happy to answer that. I guess the first model is data points lead to, they're just data points themselves, which can be one or more assessments put together. But a capability framework might say, look, we want to talk about your clinical knowledge. Now, we can get that from a knowledge test in semester 1, from a clinical skills test in semester 2, and actually a practical assessment in the beginning of semester 2. We can take multiple bits of data from a single assessment and triangulate that into multiple capabilities, which could be biomedical science, clinical skills, professional conduct, reflective practice, awareness of society needs. It's ultimately trying to say that the data points we currently have are assessments or groups of assessments, and triangulating those leads to a summative triangulation model as compared to a holistic model of what your capabilities across the whole year are. Now, I picked 10, it might be 8, it might be 9, but you can pick up those capabilities for whatever you want them to be based on the course that you're developing. The point is that you can take one assessment and get lots of capabilities out of that assessment to triangulate rather than just one particular aspect.
Thanks, Stuart. Any other questions?
Kellie, sorry, this is Priya Thomas. Kellie and Stuart, just keen to know, how is USIT going with the two-lane model, and how is it helping you in your mission towards programmatic assessment?
I think within the model that we have in the medical program, it feels quite embedded now, and that we have this sort of, we already have, I guess, a two-laned approach. There are open assessments and very high, high level closed assessments, our exams, our vivas. We have, I guess, a hybrid in between, where some of the assessments we're thinking about in terms of, we thought an observed workplace-based assessment is actually, how observed is it? Who's doing the observation? How do we put that in the system? Those system-based processes are going to be a challenge to fit within that two-lane approach, because we can think of when it's not exactly as secure as we think it is. Within, I think, the outside of the vocational degree programs, I think people are kind of, as I mentioned in the chat, letting go of their formative assessments. So they're moving away from the idea of using assessment to guide students with feedback. And a lot of them are returning to very much moving towards pen and paper exams or interactive orals. And again, I don't think that helps students because it puts all the stress back in that situation of we've got to perform in a very rigid format. And I'm not sure students necessarily want that either. So we're in a really tricky situation. I think AI has not helped the transition to programmatic or program level assessments in other fields other than vocational accreditation or competency-based frameworks. So I think that's a challenge outside of our HPE.
Yep.
I would also add that with the challenges, one of the benefits that we've had is because we needed to move to more authentic assessments in a programmatic based course, which included work-based assessments and included the need for vivas in students where we were unsure what their ability and demonstration of performance were. As Kellie mentioned, we've brought in these, which were seen as secure assessments. So we actually led the university from doing this in 2022 before the real advent or impact of AI started. So the fact that we've actually been able to move this model early and embed it and make it work has put us a bit ahead of the game. A lot of the thing at the middle is mapping what these assessments are, whereas we've actually been demonstrating that we can do them. So I think from that perspective, we've been quite useful in doing this. So I'm quite happy from what we're doing. But yeah, the ongoing area is it's really making it possible to reconsider what your assessments actually are, which I think in a way is good. It's a lot of work.
Good, thanks, Stuart. There is one comment by Edward, which is about remediation. So Stuart, Kellie, any thoughts on how you're handling remediation of students who are struggling and not meeting the expected competency expectations?
This is really difficult and a very, very vexed topic because ultimately, with most of the programs that you see, you have natural breaks throughout the whole of the year, and programs are so packed that the breaks are needed for students to recover. Now, we're having to utilize these breaks to help students get further learning in areas when they're meant to be taking time off and recovering. That is not ideal because ultimately, if you don't utilize those break areas, you're trying to get them to relearn and re-go through things whilst they're taking on new knowledge. So that's why we've utilized these areas of electives at the end of year 3 and the start of year 4 to really say, well, actually, we're going to take you away from what you're going to be doing and give you full immersion in this area. But you can imagine the students that are struggling, for whatever reasons, academic, emotional, social, or whatever reasons, to take their recovery breaks away, to remediate and do further assessments. That's actually exhausting them even further. So it's not an actual perfect model, but with packed curriculums, what do you do apart from find those opportunistic spaces to really dedicate time towards what they need? It's difficult, very difficult indeed.
Absolutely. Thanks, Stuart. Any other questions?
Thanks, Freya. I mean, I actually had a question. You mentioned, Kellie, I mean, I'm concerned with that there is not, the trend to get rid of formative assessment, and I agree with you. This is a bit worrying because that provides students with, helping them to improve. But you mentioned in your presentation, and Stuart, you just said that, what students need. How do you actually assess that at the start? I mean, you're saying start from the end, but how do you find out what students need? Is that at the start, middle, end? Before you design, how do you do this? How do you reach the students? I always find that a tricky, tricky question.
So I think the way I did it was in that first year, when we were the first 2 years, we ran our realist evaluation with the students who are currently rolling out the old, finishing off the old program. So we were able to get to our students and say, what are the big problems that are happening in the current system? We had a lot of data. The AMC had collected a lot of data about students' perceptions of their learning and their assessment, so we were able to be guided by that. There's plenty of literature within the prescribing education field that I could also gather. So I knew roughly where I wanted to be by the end. And then it was a matter of saying, well, if I need them to do, a prescribing exam, how have I taught them how to do all of those elements of prescribing somewhere over the curriculum? And then it was just a matter of finding the right places in the right parts of each part of the program. Having I guess, oversight of the whole 4 years at once meant that I had a little bit more control. I think it's been very hard to retrofit that process onto a program that has 5 or 6 coordinators, like I do in my science major. That's been a little bit more challenging. But I think we have a lot, like the medical students are amazing at telling us what they need. And so we've had this amazing, I guess, education research project on, with our students to try and inform our practice as well. So I think having a good relationship with them and really being informed by what they're doing. And also we have access to our students as they go into internship. So we interview them a lot to find out what's the missings. So that has also helped.
Thanks,
I think
Kellie.
our accreditation helps us because they say what your students have to graduate with.
Yeah.
So if you have a clear identity what you have to do at the end, then you can work back, as Kellie mentioned. Capabilities should be required at the end of year 1, 2, 3, or however many years your course is. If you're going to spiral it in properly, here's where you should be on every area of learning at the end of this year, this year, this year, and finally when you graduate, because that's what the actual accreditation body wants from you.
Yeah. Thanks, Kellie and Stuart. We'll leave it here. Thanks for your presentation and for the answering the questions. I'm sure there'll be always more. I mean, you all have the chat later, and we have the recording, to ask the presenter more questions and engage with what they're doing. So we move on. Is Anthea, you here now? Matthew, has Anthea joined, or is it just
Anthea.
Melissa?
Hi, Anthea. Can you do a quick microphone test? I see your microphone flicking on and off.
Okay.
Anthea, you need to press the button once. It's not a hold down situation. Okay. All right. Well, I think we just have to move on.
Still not working. We start with Melissa, huh? Maybe get that worked
Yes,
out.
Okay.
Okay.
Here. Hello, everyone. Thank you, and thank you for the invite to speak today. So my name is Melissa Oxley, and I'm currently at Deakin University. Just flick there to recover some time. So Deakin utilises, or our school, our MD program utilises a programmatic approach for one of our key assessments, which is the workplace-based assessment. I'll give you some better context of what that looks like in just a moment on the next slide. But I'm quite a new player in this field, so I've been working in this area for about 4 years now at Deakin, and so I came into this relatively green in that I'd worked in assessment, not programmatic assessment. So I've certainly learned a lot over the last couple of years, particularly the last 2 years here, and I aim to share some of my thoughts and reflections today with you. But I found this citation last year, and I actually had the pleasure of then meeting Priya recently at ANZAPI. So I've been sharing this definition of programmatic assessment with all of our stakeholders for that greater context of what we're trying to achieve here, and I can really relate to it. And it's what we're trying to achieve here at Deakin. So if I can just read it out, that our programmatic assessment is a systematic approach wherein outcomes of a variety of purposely selected assessment tasks are longitudinally collected, collated, and combined to obtain triangulated information about a learner's progress in developing key competency domains and capabilities. So that's what we're aiming to achieve. And specifically now, wrong computer, I'll deliver the talk today based on our current year and how we're operating this year and what we're doing. So mind the text here. I'm just going to, these are just my talking points. To set the scene, this year we have 279 students in our year 3 and 4 cohorts of a 4-year medical postgraduate medicine program. Currently, our students are on rotation. They start rotation in January and end in November. Our Year 3 students complete 23 workplace-based assessment tasks across 6 rotations, while our Year 4 students complete 36 WBA tasks across 7 rotations. This information is collected and it forms part of their e-portfolio. Their e-portfolio comprises a suite of different tasks. So these comprise tasks like DOPS, the procedural task, CBDs, mini CEXs, DEX, ITAs, as well as some others. And I have a slide at the end in extra time, question time, if anyone should ask me any questions about those. But in principle, the students are on rotation in their workplace around Victoria, even in Darwin, at different hospitals, and they seek out an assessor, usually a registrar or a consultant, to observe them performing a task. And this information is captured on a form where we ask for certain feedback. So each form, in setting all of this up, which I'll speak to a little bit more again in a moment, we deliberately capture feedback on key competency domains, these being clinical expertise, communication, professionalism, as well as a global rating complexity, as well as other information like what did the student do well, what can they do better, any concerns, and any other feedback. The feedback on these forms and during this process is dual purpose. First and foremost, it does serve for student learning, but it is the same information that we then use to make decisions. And this, I think, is an important point as well. So for context, this year we will start and manage over 9,000 forms. And so we do capture everything digitally and not on paper. Every student, we will collate that information from their e-portfolios into a final report. It's a nice, live, dynamic report. This report will, and I'll speak to that in a moment as well, but that report goes out to 3 desktop reviewers who will make a recommendation. Those recommendations are then collated and presented on panel day in front of a panel for an ultimate outcome. We really are asking, is there enough evidence here to be confident that this student is ready to progress to either year 4 or to intern? So my last slide here is this one. I'm going to take you through some of my reflections, very much aligned with the advice that Kellie and Stuart have just given. So a few of my points here are very similar to those. I'll speak to some of those, but some further ones as well. So I think what's important first and foremost is the student is creating their WBA portfolio based on these assessment tasks longitudinally from January to November, and both for their learning and for assessment. And some key considerations, certainly lessons I've learned and we've learned as an institute and a school, and some challenges faced are these. So I'll speak to some of those in more detail, but I'd like to start with this first one being very much like Kellie said at the beginning, that this is a very complex assessment and particularly with very tight deadlines. And that can't be lost in all of this conversation. Effort intensive with multiple stakeholders, and I will be speaking to some of those points as well as we move on. So first and foremost, given this complex assessment with tight deadlines, the aim here is to capture, store, collate, synthesize data as feedback, as well as some other data, particularly in a digital space, so it's manageable. We've moved away from paper. We often get the question, can we go back to paper? And the answer is usually no. If for our clinicians to assess our students, it needs to be done in a digital space, whatever that looks like. So moving forward, my biggest piece of advice then for any new players in the field is to consider the final output and reporting style first and not last. And I've got some examples here, for example, to set the context of what I mean by this. Basically, this is an example I've mocked up for today. You know, a student has produced an e-portfolio across the year, and it's time to collate all of this information. And so my biggest really piece of advice is, how does that look? So we've broken down our reports into sections. We've collated a summary of what tasks have been done in that with that longitudinal scale being first and foremost, followed by the breakdown of pieces of data and information, noting that we're presenting data as both graphs, tables, and we are dissecting and synthesizing and presenting data from different lenses. So we might focus on a particular task, like a procedural task in one table, but then later on that same information is used to talk about or to present to the panel and desktop reviewers a longitudinal growth or in professionalism or communication, for instance. So at the end, scrolling up and down through this report, we asked then that our reviewers, our desktop reviewers are making a recommendation, and this will be seen by the panel. And we're asking, is there enough evidence here to be confident that the student is ready to progress? Importantly, what we're looking for is key gems like this. These are all discrete pieces of information, and they come together to showcase student growth, as an example here, from January to October. So I'll flick through these other ones very quickly. Like Stuart said, needs to fit within student policy on assessment. Advice is, during that developmental stage, consider your blueprinting, setting key competency domains so you can build those final reports. Maintain it across multiple iterations to really capture, where you need to grow this from. Consider dual purpose this is dual purpose feedback. Some work we want to do on is some of the language that the clinical assessors will use and how that is used then and interpreted by the student for feedback, but by our desktop reviewers for assessment purposes. And a couple other more here is we're really trying to maintain that collection of rich data, and in doing so, maintaining authenticity, equitability and robustness in the assessment, as well as building in mechanisms to handle unforeseeable circumstances, something I can talk to in a moment. Mindful that, I think Stuart talked about the evolution of the assessment, and so did Kellie. We've been in the same space. We've been doing this for a couple of years now. We've got to the point where we've set some rules, and this just gives some boundaries to the students on what they need to be achieving, but also builds in some of those mechanisms for, for those unforeseeable circumstances. Lastly, or second lastly here, we've got management. Others have talked about this. Huge amount of stakeholders and intensive hours put into this, but questionably not as expensive as you would think to run, in our case anyway, compared to some OSCEs and some other of our other assessments. But what needs to be constantly developed is resources for our students, particularly for the clinicians and assessors that are in the hospital setting, but also, those that are reviewing and making those final outcomes, as well as admin staff and others who are stakeholders in this assessment. And lastly, my final point, sorry, I keep pressing the wrong mouse. So we constantly every year come up with new mechanisms for resources and how to disseminate information to students and keep them on track with this. And finally, really to keep it scalable, to make it scalable. So the idea is that this will accommodate growth in students, but also growth in complexity and the evolution in this space. And the last example I'll provide there is, for example, the Acclaim group have working together with for a new framework in WBA space. We haven't yet incorporated that, but we aim to. And I do believe, and when they come to me and say, can we do this? The answer is yes, because the mechanism we have at the moment is scalable. Mindful of time, so that's my final slide with my thoughts and practical insights, and I can take some questions at the end as well. Thank you.
Thank you, Melissa. Just note some questions, put them in the chat box. So Anthea, is your mic working now?
I hope so. Can you hear me?
Yes, I can see. Yeah, okay, excellent. Over to you. Thanks, Anthea.
Thanks very much for having me. Thank you, Priya, for the invitation, and Matthew for putting up with my tech knowledge. My name's Anthea Cochrane. I'm from the Department of Optometry, the current course coordinator of the program at the University of Melbourne. And I just want to acknowledge that I'm on the lands of the Wurundjeri people today. And I'd like to talk to you a little bit about our program, just give you a little bit of context. So we're a 4-year postgraduate program at the University of Melbourne, and we use programmatic assessment as a feature of our course structure. Today, because of time, I'm just going to focus on the final year of our 4-year course. And the overarching principle is that it's a pass-fail year. So the students' performance across various curricular areas is judged by a portfolio committee based on a collation of data points, similar to what we've been talking about in this session. And students, in order to do this year-long subject, we only have about 80 students, so we have much less data points than what we've heard in some of the other presentations. But the students have 5 main skill areas to show us aptitude in, and those are listed here: optometric knowledge and skills, patient care, evidence-based practice, communication, and professionalism. And why do we have this model of pass-fail, and what do I think are the programmatic assessment aspects of what we do in this final year of our course? So I think, this is high stakes. These students are becoming APRA registered at the end of their year, and it's traditionally an area that's traditionally, hard to assess high stakes assessments, and the failure to fail issue comes in. So programmatic assessment, I think, helps us in that area. We're an APRA registered course like many others on the call here, and so we can match our competency framework to our programmatic assessment, and Stuart talked about that approach as well. Learning at multiple feedback points in different ways, I think, is a feature of using programmatic assessment and why we use it. And finally, we all know this issue about human judgment in a clinical environment in particular, and programmatic assessment helps us with this. And I suppose the thing to add that I hadn't thought of until today is that programmatic assessment is going to help us in the AI space. I wanted to just highlight that in my mind as course coordinator of this program, I'm thinking about programmatic assessment both in coursework and in the clinic. And across coursework, the way we manage it in our Doctor of Optometry program is this maintenance of a diary, a daily kind of reflection of what's gone on. And then the students also need to integrate into their portfolio clinical feedback they've had, written work that they've done, OSCEs that they've done during the year, and other activities, things like an advisor agreed project that they do, which helps them kind of explore some of their electives, if you like. And assessment decisions are made by us looking at this portfolio at the end of the year, where each of the 5 subsections that I've got shown in green on this slide are marked individually by an academic staff member, and then a panel reviews the overall decisions for a final year outcome, which is pass or fail. And if I just talk to the clinical placements aspects of the programmatic assessment as well, in that space, our clinical supervisors at 2 key sites where the students go for about 2/3 of their placement year, they get feedback per session, which is, in our context, is every half day from the interaction with their supervisors. And you can see a little form, which is very familiar probably to many, with the student self-reflecting first and then us giving some feedback. But it's the accumulation of all this data that helps us in the end to make a decision about the patient passing, about the student passing or failing, based on a feedback system rather than an assessment system, although the two are intertwined, as we all know, where students are given an excellent, satisfactory or unsatisfactory rating for each of the half-day sessions that they do. So the feedback from lots of data then gives us an overall picture for the students' performance during the year. And in my time as course coordinator, I've seen us be more successful in making sure that the students who need to repeat a year do repeat a year with this model than in previous models where we didn't use programmatic assessment as much. I've not got time today to talk about this, but my real area of keenness is professionalism in optometry and in other of our professions. And programmatic assessment, I think, is the only way of assessing professionalism. And so that's part of why I'm fascinated in this particular way of thinking about students. My key thoughts of the work that I've done in this space are that programmatic assessment allows for different learning strategies and styles to be incorporated, and I think that's really important for our learners. I think programmatic assessment, beyond what I've talked about today, is really important at a horizontal, vertical integration. And I think the programmatic assessment allows a different way of this progression of knowledge and reinforcement of key concepts, which I think is why it is a good model at university level education. So thank you for your time. I'm happy to take questions, and these are my contact details if anybody would like to reach out following this presentation. Thank you.
Wonderful. Thank you, Anthea. Excellent. So we're going to, I mean, really with time, just go a quick few minutes for question time. Priya, you got a question for Anthea about the programmatic approach. How do you identify, Anthea, students who are likely to fail?
Now, that's a really good question. So we have got a system set up where I've got eyes on how the students are going in clinic and also in their other pieces of assessment on a daily basis if I want to. But I look at it weekly and I can see where the students are tracking, and the system has a way of kind of highlighting for me where students are not going well. It's a system that we've set up ourselves based on our kind of, I suppose, specific needs around optometry, but it's probably translatable to other disciplines.
Thank you, Anthea. Other question, I'm just scrolling through. Anyone having a question for Melissa or Anthea?
I was just wondering, Edward, would you like to ask your question? Because there's a lot of interesting chat that you've been doing around the data points. So I was just wondering if you want to ask the question to Anthea or to Melissa. Do you want to mute yourself, Edward?
Apologies that it took so long. I've typed a lot of things. I'm not sure which question you were referring to, Priya.
Oh, your comments have been so insightful, but you were talking about the data points.
Sorry.
And you have been talking about the data points as in the number of assessments and assessment overload. And I thought that was an interesting thing to discuss here.
Happy to raise that. My question or my comment there was about whether we are over-assessing rather than over-assessing. And so the point I made was that most of the programs at my institution, especially anything in health or other professional degrees, have professional accreditation standards. They have program learning outcomes set by course teams at a course level, and they have our institution's graduate attributes. And if you start adding those things up, you know, a lot of people have been talking about start with the end. Where are you trying to get to? The end that we promise students will get to, we currently state in terms of, in some cases, 30 to 40 different learning outcomes. And as people in the chat have made clear, ideally there would be at least a lot of overlap between some of those things. But I know from my experience here, that's not always the case. But trying to find data points across a program for that many outcomes magnifies the challenge of that.
Interesting. I was wondering if Melissa, do you want to have a quick reflection on that?
Yeah, my reflection is that no, I completely agree with Edward. We're facing the same challenges where we are, especially moving across re-evaluating the year 1 and 2 space where we do have that many learning outcomes as well. I guess we've got lesser in year 3 and 4, and this one assessment of several covers off on only a couple of those learning outcomes, particularly around I haven't got them quoted here, but around that readiness for being an intern, for instance. And so I guess my reflection is absolutely I agree with you completely. I think it's a challenge we all face. I think there's some comments in the chat as well. I think the solution is just to keep reevaluating what we're doing with our assessments and our approaches, with the decision making as well. And I think, really blueprinting or including on those forms that ultimately get collated, or the assessments. In my case, it's the forms that we're collecting across the year that form that e-portfolio. For others, it's different certain assessment pieces for ultimate judgment and outcome delivery. So thank you.
I'm sorry, folks, we do have to move on We're going to have a quick 5-minute break as we have to swap over. So hopefully we can see you back here in 4 minutes time. So thank you very much, folks.